Good morning, everyone. My name is David Savitsky, and for my disease, I did Rocky Mountain Spotted Fever. So before I like to begin, right here in the bottom left corner of your screen, you will see the disease in a dark red or maroon color on the cell. And that cell's supposed to imitate a blood cell in the human body, which is what it feeds on and eventually will cause the disease and other hallmark characteristics of the disease. So some basic general information. The causative agent is Rickettsia rickettsii, or R. rickettsii for short. It is a zoonotic disease, and it is spread through the tick. More specifically, the American dog tick, the Rocky Mountain wood tick, and the brown dog tick. Fun fact, though, the Rocky Mountain tick is what it is named after, not the Rocky Mountains in the western United States. And other reservoirs include infected humans, house pets, small animals, and woodland animals like deer, squirrels, and chipmunks, and all that kind of stuff. So some other characteristics is that the Rocky Mountain Spotted Fever is a gram-negative disease. It is an aerobic disease. It is a coccobacillus, and it is very small. So small that it can fit in the nucleus of most cells, which is actually very interesting considering most diseases. In addition, it can cause blood vessels to weaken or die, which causes blood to leak into the bloodstream and blood tissues, which can cause a lot of the symptoms, and this is eventually what causes the hallmark rash, which I will get into later. The mortality rate for this disease is usually between 3 and 5% if the patient is treated, and 13 to 25% if it's untreated. However, the average rate, according to the CDC, as of the recent years, is 0.5% in patients. And as you can see in the graph to the bottom right, it shows the prevalence of the disease and when it most often occurs, which is usually between the months of April and September. So this map shows the area of effect, and as you can see, it is most prevalent in the Midwest, like in Oklahoma and Nebraska, as well as in the American Southeast, and then by the Gulf Coast and in those areas. So the disease was first discovered in 1896 in the Snake River Valley in Idaho, and it was given the name black measles because it resembled the measles rash, but the dots were much darker than the measles bright red. The first man to actually isolate the bacteria and identify it was Dr. Howard Ricketts, and that is why the disease is called Rickettsia rickettsii. He also was the first to develop how the tick vector transmits the disease to humans, and ticks transmit the disease to their offspring. So just some basic outbreaks that have occurred. I've been in 1983 in Texas, 2002 in Texas, and then in 1937, and in the early 2000s in Cordoba, Colombia, which is another area where the disease represents. The disease also doesn't go outside of the Western Hemisphere, so North America and South America is where it's usually found. However, other rickettsii-based diseases have been found in all continents across the world. So some basic symptoms for RMSF are that it can begin 2 to 14 days after being infected, is when you can start getting symptoms, and that's also the incubation period. Your basic symptoms include you have fever, headache, nausea, vomiting, muscle pain, stomach pain, loss of appetite, and the hallmark characteristic rash. And the disease can also cause some long-term problems if it is not diagnosed quickly or not diagnosed at all, which can be amputation of limbs, you can lose hearing, you can get mental disabilities, and all that's just not great. So the hallmark characteristic of the rash. The rash starts at the extremities, like your wrists and your ankles, and it can work its way down to the fingers and toes, and work its way also up into the trunk or chest of the body. As stated earlier, it is caused by the weakening of blood cells, and it appears usually 2 to 5 days after you get the fever. So this shows the number of cases between 1993 and 2014 from the CDC. As you can see, the cases have increased since then, but are on the decrease since 2012, where the highest number of cases was reported. So the affected age group usually starts in those who are 25 to 29, and the most at risk are those between the ages of 55 and 64. Although recently there was a toddler who died at the age of 2 because of some complications with that. So how can you diagnose this disease? Well, if the diagnosis for Rocky Mountain Spotted Fever is usually a blood test, and the blood tests take time to get back. So that is why if you're suspected to have Rocky Mountain Spotted Fever, one should start treatment immediately, and because you don't want to get any sort of long-term effects, other complications, and you can even die from this rather quickly as well. So if it goes undiagnosed, the following can develop within a person: gangrene, pulmonary hemorrhages, acute respiratory distress, myocarditis, acute renal failure, and as I stated, you can also die from this. So if you do get bitten by a tick, you should tell your doctor, and you should tell them when you've been, or if you were around ticks, how often the bite, how long ago the bite occurred, and if you've exhibited any symptoms since then. So this graph shows the death rates the death rates and the cases per million from 1920, and then its projected value to 2020. So as you can see, the cases per million started off really low, and then they started to get higher and higher once it hit around 1970. However, the death rate has also dropped significantly since 1940, and as you can see, around 2010, it's close to zero. So prevention and treatment. So the main way to treat Rocky Mountain Spotted Fever is through the antibiotic doxycycline. However, this antibiotic is not recommended for pregnant women or people who have an allergic reaction to this type of antibiotic, which is why the other antibiotic, chloramphenicol, is an alternative. And so also it says right below there, complications can also be avoided if treated within 5 days of the initial symptoms. So how do you prevent Rocky Mountain Spotted Fever? Relatively simple. You want to wear long clothing, especially if you're camping, hiking, or in an area known where ticks are. You want to use insect repellent, especially in the summer if you are able to do so. And then you want to check yourself for ticks if you come out from going on like a hunting trip or camping in the woods, even going through the woods just in general. And then you want to remove said tick with the tweezers. Now, for those of you who don't know how to remove a tick, the basic process is that you want to get the tweezers as close as you can to the skin, and then you want to pull it straight out. Don't jerk or twist the tick, because that can cause the tick to separate. And the head of the tick is what causes most infections and diseases, that are tick related. So you basically want to pull it out slowly and don't want to try to sever the head from the rest of the body. That's just the full way to remove a tick can be found online on the CDC website, and you can even ask a doctor that as well. So that's my work cited, and I look forward to taking questions in class on Wednesday. Thank you.